Okay, so let's talk about how to do a proper exploratory stroke. So as we go in, we're going to make sure we have the correct working in here. So when we go to the distal, we place it interproximally. We notice that the V is pointing to the D. We also notice that the terminal shank is parallel to the long axis of the tooth. So we know that that is the correct working in, okay? So we're gonna fly in, we're gonna go to that distal now, and we're gonna start at the distal line angle, okay? So here, right where, before it turns the corner is our distal line angle. So we're gonna start here, keeping that terminal shank as parallel as possible, keeping that 1 to 2 millimeters of the working in adapted at all times. We don't want the point of that working in off of the tooth, as it could poke into the gingival tissue and make it quite uncomfortable for our patient. So we want to keep that tip adapted. We're going to start at the distal line angle. We're going to do some light exploratory strokes here, overlapping as we move into the interproximal space, getting up and underneath that contact. We want to fully explore into that interproximal space. Give it a few light exploratory strokes. We're going to pull out. Our tip is going to point in the direction of the way that we're moving. So if we're moving to the distal, our tip will point to the distal. If we're moving to the mesial, our tip will point to the mesial, okay? So look at it as an arrow pointing you in the direction that you're gonna head. So here we've explored the distal, but we're gonna come out. We plan to go towards the mesial now. So we're gonna go back to the distal line angle. We wanna explore this area twice, as it is the most often area where calculus is left because it's a difficult area to access and feel. So we want to go back to it and we want to explore it one more time to make sure we did not miss anything. Light overlapping strokes here. We're going to go around the tooth doing light overlapping strokes. Now as we get to the mesial line angle here, we're going to want to make sure we watch that tip of that instrument. We never want it to pull off the tooth and start going into that gingival tissue. So that space we talked about on your handle is going to play a role now, because now we're going to need that space to roll our instrument in order to get it interproximal without the tip coming off the tooth. So as we move to the mesial here, we're going to start rolling as we come to the corner. We're going to really go, and we're going to really roll as we go into that interproximal space, keeping it adapted all the way under that contact and giving it a couple nice exploratory strokes. So let me readjust this here just a little bit so maybe you can see that mesial better, and we'll do that mesial one more time. So again, getting your placement, pointing mesially, entering at the distal line angle, giving it a couple nice overlapping strokes here, moving into that mesial space. As you get to that corner, you're going to roll your tip onto that tooth, keeping it adapted as we roll into that interproximal space on the mesial, up and underneath that contact. Okay, very good.